Hi, everyone, and welcome to this session on leadership in global health equity, an intergenerational approach to global health governance. This is going to be an interactive session, and it's based on the backdrop of the recent 2024 Summit of the Future. This session will explore how intergenerational collaboration can serve as a powerful driver of leadership and governance in global health equity. So my name is Beth Stinchcombe. I'm a UK medical student and currently the International Federation of Medical Students Association's liaison officer to the World Health Organization, and I'm also a member of the World Health Organization's Youth Council. And it's a pleasure to be moderating this session. I have two guests who will be joining me, and I'd like to introduce you firstly to Eric A. Friedman, GD. He is the Global Health Justice Scholar at Georgetown University Law School, O'Neill's Institute for National and Global Health Law and Policy, and a former senior global health policy advisor at Physicians for Human Rights. Eric is also the founding and current executive board member of the Framework Convention on the Global Health Alliance, which advocates for a global treaty grounded in human rights and aimed at national and global health equity. We also have Mark Allen Daggerman joining us, who is currently the Public Health Activities Coordinator of the International Pharmaceutical Students Federation, IPSF. He has various experience in launching public health campaigns, specifically in HIV and AIDS, medication awareness, and patient safety. In terms of intergenerational collaboration, Mark has had the opportunity to collaborate with professionals from diverse backgrounds during the World Health Day 2024 and throughout the collaboration of IPSF with UNAIDS on the High Five for HIV project. Thank you both for joining us, and a warm welcome to everyone else attending this session. Please note that we will have a Q&A segment at the end of the session for around 10 minutes. And if you have any questions throughout, please feel free to type them in the chat, indicating which speaker your question is directed to. Alternatively, you can raise your hand and unmute yourself when prompted. But first of all, we have some questions prepared for each of the speakers, so let's get started. So my first question today is to Eric, and it is, what is the Framework Convention on Global Health, and how can it foster and benefit intergenerational equity?
Great, thanks, and thanks very much for having me here. It's great to be able to talk to everyone and see, and well, not see all of you, but talk to everyone. So thanks so much. The Framework Convention on Global Health, as you actually mentioned briefly in your introduction, would be a global health treaty rooted in the right to health and human rights and aimed at national and global health equity. The idea behind this treaty, the idea's been around a while, the treaty not yet, is that even though the right to health has existed in international law for many decades, implementation, as we can see, sort of looking around us and the huge health inequities, among other things, has been leaving a lot to be desired, let's say. And so the idea is a treaty that would create specific mechanisms and standards that would make much more specific what right to health requirements are. The idea with the treaty is that it would really be an empowerment tool, empowering civil society, members of the public to sort of say, look, very clearly, you are supposed to do X, Y, Z, and it's legally binding, and they're not. And so through advocacy, litigation, and so forth, advance the right to health, take it sort of a step, or hopefully more than a step, beyond where we are now. I'd be happy to talk about that more in Q&A in general with the treaty. In terms of intergenerational health equity, there's certainly a number of ways that it could bolster that. And just I should preface by saying the treaty is not yet drafted. We have a few pieces, possible pieces drafted. We hope to be working on more in the near future. But one basic thing is defining health equity and making very clear that the definition of health equity and what the right to health requires and what human rights requires is an intergenerational health perspective that we need in developing policies to consider the health impact of people not only now, but certainly, I mean, younger people now as well as older people, but also what will be the fact 50 years from now, 100 years from now, and is what we're doing now undermining that? So one is definitional. Another is participation. One possible mechanism approach that the FCGH could take is to include a very clear standard of what does the right to health, the participation component of the right to health require, and being very clear that everyone who's affected, including future generations, including sort of the youth, need to be part of that participatory process. So if it's going to affect youth now, if it'll affect youth sometime hence, if if affect children, or conceivably even affect children in future generations, then sort of representatives of those generations need to be part of policy making processes. So that would be another possibility. And then just maybe I'll mention one more, is that one of the specific tools, approaches, mechanisms of the FCGH, that Framework Convention on Global Health, that we've considered is a right to health assessment. Sort of familiar to all of you, the basic idea of environmental impact statements, assessments, to sort of at least understand what will be the impacts in the environment of a particular policy or project. Same basic idea, only this would be for policies that could substantially impact the right to health. What would be the health equity, the right to health impacts, and to make clear that those impacts shouldn't be just consideration, over the next 5 years, but looking longer term, even intergenerationally, what are those impacts, and is what we're doing now, or could what we're doing we're doing now undermine health equity in this particular policy or project in the future. And so those are a few possibilities. Like I said, the treaty is still to be developed. And so there's certainly, I'm sure, many more. And if I may just have a plug, you can learn more or contact us through our website at https :/, fcghalliance.org, and or contact me. We'd be happy to talk to you more about this. Thanks so much.
Amazing. Thank you so much, Eric. And that sounds like would be a really, really powerful tool to kind of keep people accountable about the importance of kind of health equity and bringing intergenerational equity. And I think that's kind of needed more now than ever, with we see with kind of pandemic preparedness and IMB12 and kind of climate change and health. So having something that would concrete that we would be able to kind of use and keep kind of member states and governments, etc., accountable, I think would be really powerful. So yeah, it would also be great to learn more about that and how that could kind of evolve as well. But now we're going to move on to Mark, who is a youth leader himself. So Mark, how can intergenerational collaboration strengthen leadership in global health governance, especially in addressing equity challenges?
Yeah, so thank you for the wonderful question, Beth. So I believe intergenerational collaboration can help strengthen leadership in global health governance, primarily through that it allows innovative exchange of information between young people and seasoned professionals. So I believe if not all, most of our participants here with us have a general understanding of intergenerational collaboration. So I would like to contextualize further the intergenerational collaboration from a youth perspective. So for me, intergenerational collaboration is where students and young professionals take the chance to first listen, observe, and learn. Because in collaborative settings, usually the seasoned professionals, they generally have more experience and knowledge. So the young people, such as myself, are primarily recipients of information. But at the same time, thanks to this opportunity to listen, to observe, and to learn, young people are now able to ask and affirm through their own understanding. I believe it is through this I believe it is important to establish as well the avenue of receiving information, because from a theoretical standpoint, we are now able to formulate perspectives that understand experiential knowledge while incorporating fresh perspectives as well. So going back for leadership and global health governance, this is actually a great avenue where an exchange of information between youth leaders and government leaders can occur. So this is because aside from having the opportunity itself to step into an international policy-making body. So to concretely explain this, for example, through the landmark agreement of including youth in the World Health Assembly back in 2012 and 2013, so aside from the participation of youth itself, that inclusion, it formalized and recognized the role of young voices even in the field of health governance. So going now to my next point, this meaningful youth involvement addressed equity challenges because young people now become central to the global health policy and governance. So due to this collaboration, we can now ask questions such as how are youth affected by these treaties and policies that we develop? And more importantly, what are the perspectives of the youth themselves and how can they contribute to sustainable solutions? So I believe through this exchange, um, the, the exchange between young leaders and seasoned professionals, they can contribute to global health governance, leadership in global health governance, and in addressing equity challenges.
Amazing. Thank you so much, Mark, for your comments. So now we're going to move over to the next question, which is again for Eric. And that is, there are many middle-aged and older people who are very much involved in health governance. This is either kind of holding leadership roles in government or kind of in non-governmental organizations. How can we enable youth participation in these spaces, ensuring an intergenerational health equity perspective, whilst also fostering kind of collaboration between people at all life stages in order to promote intergenerational solidarity? Oh, Eric, you're muted.
My apologies to all. I was just saying thank you for the question and thank you, Mark, just now for those very, very important and informative perspectives. In terms of the current question and getting youth participation structured into global health governance, which, because as you said, generally sort of, or as Mark so nicely put it, seasoned professionals are already part of it. Bringing youth into the space would really promote automatically, in a way, solidarity working together. I'll point to a few examples. With the basic idea of ensuring that youth are part of the governing spaces, decision-making bodies. For example, I should just go back for a second to one thing I mentioned before, the Framework Convention on Global Health, is recognizing that the right to health in fact requires that intergenerational perspective, youth voice. And so when policymakers at any level are sort of thinking about who should be involved, youth are automatically sort of one of the people or one of the sets of people, sorry, that they consider. Another possibility is having official representation, which in a ways, in some spaces, intergovernmental spaces, official representation gets you only so far. But actually, a very good example comes with the organizations of my moderator and my panelists, with the medical students and International Federation students, both of whose organizations are in official relations with the World Health Organization, which not only allows them to make statements at the WHO, which probably more importantly, because I don't know how effective those are from my experience, you can be, if it's physically possible, to get there, you can be in the room during the discussions with the delegates from states who actually are going to decide on policy and talk to them, influence them, that exchange of information that Mark talked about. And so that's one really good thing. Unfortunately, the official relations, you don't have enough of power even in official relations, but that's a real bigger structural issue of WHO, but that's one really good thing. Example. Another is in areas of global health where that are open officially in terms of non-governments to be involved in decision making is have youth delegations. Specifically, I'm thinking about, for example, the Global Fund, Fight AIDS, TB, and Malaria, which has delegations, different government delegations. Some specific governments are always there, like the US. Some are based on regional groupings, but they're developed country NGO delegation, developing country NGO delegation. There's private sector, there's foundations. I'm probably forgetting one or two. But what about youth? I mean, especially, the issue of HIV/AIDS, TB, malaria, HIV/AIDS is a huge impact on youth, including particularly with girls, disproportional impact, very much so. Malaria is above all a disease that strikes and kills young children. And so why not a delegation specifically focused on, made up of people from youth organizations, of youth leadership. And that same sort of thing could apply to any number of multilateral health organizations that are developed as partnerships and not only purely as government functions. And one actually good existing example of this is ECOSOC, which is the Economic and Social Council of the United Nations, which is a body comprising all states that oversees economic, social, cultural issues. The health and human rights are all sort of part of this. And they have something called, I think there are 21 major groups and other stakeholders who have very considerable scope for participating in ECOSOC related meetings, discussions. And actually one of these major groups is youth and children is one of these major groups. And so they actually are structured into the process of, again, ECU, and ultimately the decisions are states, but in terms of many discussions, inputs going into those decisions, youth are part of that. And then the last thing I just mentioned, given the importance of government delegations, is to have youth as part of government delegations. Generally, they're not actually standards in terms of, who needs to be part of them. That's up to governments, and some like the US have huge delegations, have plenty of room for youth. Some unfortunately in a much bigger problem of global health governance are severely disadvantaged because they're small countries, low resource, so maybe they have 3 people. It might be a little bit harder. But where possible, include youth in the delegations, and they could be both youth sort of as representative of youth, and they could be, young people, young professionals who are filling whatever, government jobs or other positions that might be in the delegations. Any of it but look towards youth. And so there are a few possibilities. Thank you.
Thank you so much, Eric. Yeah, I think youth delegate programs have such potential. And just for the past few years, when I've been attending kind of the World Health Assembly, we've seen youth delegates kind of grow from maybe 3 or 4 a couple of years ago now to last year having about 17. So it's definitely something that's kind of being worked on, and we're seeing some progress with it. But yeah, I think there's still kind of lots of barriers. And I think actually, interestingly, like you mentioned, Eric, that yes, often sometimes smaller countries have kind of difficulties maybe with the amount of work they have to do in smaller delegation, etc. But I think we've actually seen that those countries sometimes are actually more open to having youth as part of kind of their programs. I know from my experience in the UK, we've tried to start a youth delegate program, and there's been kind of a lot of backlash and barriers that we've had to kind of go to, even trying to finding the right person to talk to about it. Where I've had friends from kind of Pakistan, Morocco that were at the World Health Assembly last year that just kind of went and spoke to their member states, and their member states were like, yeah, of course, we'll have you on board. So I definitely think there's a lot of progress to be made in that area, and kind of that's something hopefully we'll see growing in the next couple of years. So my next question is to Mark, which is, what barriers exist that prevent meaningful youth participation, and how can they be overcome?
Yeah, so for the barriers existing, currently, I believe the first on top of my mind is token representation. So this happens when youth are included basically for appearance purposes rather than asking them for substantive input. So we can address token representation primarily through, for example, mentorship programs wherein we pair the young leaders themselves with experienced professionals. So at the same time, we are not letting the youth decide by themselves alone. Instead, they are guided by seasoned professionals that has undergone many years of experience, many years of education. So through this way, we are involving the youth, but at the same time, we are ensuring that they are guided through step by the seasoned professionals themselves. So I think another barrier as well to meaningful youth participation is, of course, the limited access that exists in various countries all around the world. So, for example, we all know that for youth to participate, there has to be opportunities for them that can open these participation or these avenues of participation itself. So but we should acknowledge that opportunities such as this, such as participation in global health policy avenues. So all of these opportunities, they sit at decision-making tables. So if we only let seasoned professionals sit in those decision-making tables, I think we are forgetting the perspective of the youth. So what about the young people who are very eager, very willing to contribute their ideas and their energy to addressing systemic problems that is currently occurring in our society. So to address limited access such as this, I believe one important factor is capacity building. So through capacity building, we can provide training in policy advocacy and negotiation skills because we all know that even though youth leaders are very eager and very willing, they still need training and guidance. And one way to do this is to increase their capacity on how to do these things. So I think youth leaders themselves should be guided step by step on what are the ways that they can start little by little on capacity building matters. And I think on the third barrier on top of my mind is financial constraints because for us to allow meaningful youth representation, of course, it entails funding. So, for example, there is a policy making body or an assembly at a certain country, but the youth leader themselves are scattered all over the globe. So for them to be able to participate face to face in that event, they need to fly out of their countries to that venue. So such avenues like that, it entails cost, and therefore financial constraints limit the ability of youth to participate in meaningful conversations and um, meaningful opportunities as well. So to address those financial constraints, of course, I think it is obvious that there should be institutional support as well. Not only funding, but institutional support by creating roles in which youth themselves can serve or contribute on their own capacity. For example, in governance structures. So by including youth in these governance structures, in, uh, we can also take what is the youth lacking for them to fully participate in certain conversations and certain opportunities such as this. And lastly, for the barriers, I think it is also important to acknowledge the barrier that there is a lack of training for youth leaders and youth professionals who are just starting in their fields. So I believe that having insufficient capacity building for youth, it limits their ability to engage meaningfully. So for you to have experiential knowledge, since we acknowledge that seasoned professionals themselves have a higher experiential knowledge. So for youth leaders to at least go above or try to approach that level of the seasoned professionals, I think there is an importance to highlight that there is a need of training and of course inclusion of youth to these involvements. So I believe those are the barriers and respective solutions in which we can address meaningful youth participation.
Thank you, Mark, for highlighting them. I think definitely kind of capacity building is something that kind of gets overlooked. It's kind of expected that we as youth kind of know how it is to kind of be in different spaces and kind of how to do different kind of tasks. And yeah, that's something definitely important to highlight, as well as kind of financial and kind of visa issues, like you've mentioned. That's a big thing. Like a lot of the work that youth do sometimes transactional, but then also kind of just expected to kind of, we do it for experience, we need to learn. Whereas actually kind of the work that we're doing, other people, you know, who are would do get paid for. So I think it's kind of really important to kind of highlight these points, that in order for it to be kind of equitable and to have youth involved, we really need to kind of tackle some of these big issues. So thank you so much for sharing these with us. So now we're going to go back to Eric, and hopefully on a bit more of a positive note. What are some of the examples of successful intergenerational partnerships in global health that have kind of led to impactful policy changes?
Thanks. Okay, unmuted. First, actually, I just wanted, if I may, for a second, sort of reinforce a point that Mark just made, and you made too, just now, about capacity building and the importance. Um, I think both, as you were saying, Mark, in terms of youth to be able to participate effectively, but also in terms of policymakers taking youth seriously. They might say, "Oh, they're just young people," but looking at the example, I'd say, especially of HIV/AIDS, early AIDS advocacy in the US, not at youth per se, but at marginalized groups who policymakers didn't like, stigmatized, did not want to listen to, thought, hey, we know more than them. They became really world-class experts on the science, the medical possibilities, research on HIV, AIDS. They knew as much or more than many of the officials, the government officials they were talking to. And so that sort of forced the officials to take them seriously. And I think in the same sort of way, to the extent that youth really can become very knowledgeable about these ideas, it becomes much harder for those who would dismiss youth as just kids and just children, what do they know, as being people who really, voices, people who really need to be included. So I just wanted to add that point, if I may, which I did so. Two examples of the intergenerational collaboration. The first is in technical collaboration. It's sort of separate, but collaboration in spirit, which is in climate change. Obviously, a huge issue for all of us, impact the health above all of the youth who will be here for very, very bad effects, unfortunately. There's a growing numbers of cases, of court cases, both domestically and internationally, challenging governments as well as private corporations, saying they're not doing enough, they need to be doing more to fight climate change, to reduce greenhouse gas emissions. And there have actually been growing numbers of successes too, including, and of relevance for now, a case brought specifically by elderly women in Switzerland and by children in Montana. In the Swiss case, the women is an organization of, I believe, more than 2,000 Swiss women, argued that the government, Swiss government, was violating their rights by not doing more to reduce greenhouse gas emissions. This was before the European Court on Human Rights, and that court agreed. And it said that as part of the European Convention on Human Rights, which is a treaty binding, human rights treaty binding on European governments, the government has to respect private and family life. And within that right is the right to have effective protection against climate change. And the Swiss government had not was not doing enough to meet its own targets, did not have specific policies, such as the carbon budget, to actually make the progress it said it was going to meet, and therefore is violating its obligations. That case, that really, I believe, is the first international judgment of the sort on on climate change, thanks to elderly women. And then on the other hand, and then as well in the United States, last year, there's a decision by a court in Montana that the state government of Montana was violating its obligations with respect to climate change and health. And that was a case brought by youth who said that the legislature's rather quite unscientific of approach to project assessment, which specifically banned um, evaluating the effects of greenhouse gas emissions with respect to the impact of projects and when determining whether to approve those and whether they met environmental standards. The court said, no, there's actually in the Montana State Constitution, right to a healthy environment, this case, or rather, this law, and actually a broader policy limiting consideration of global consequences more generally, this violated the Constitution. So not exactly literal collaboration, but collaborations in spirit, where you have the elderly and youth coming from their own perspectives, own places challenge and successfully challenge their governments on one of the most consequential health issues and all issues of our day. The other example I'll give is more of a direct example of collaboration, which actually comes, I used to work at a group called Physicians for Human Rights, an NGO that back when I was there, one of our major campaigns was on HIV/AIDS. This is going back some time when AIDS was really, at the beginning of the time, especially at the very beginning, there was no PEPFAR, the US AIDS program, yet the Global Fund was just getting underway, and AIDS in Africa, especially, is making huge headlines. It was just really, I mean, it's still very, very bad, but it was really seen as an existential threat, and for good reason. Our campaign and the way that PHR Physicians of Human Rights worked was to have health professionals, but also health professional students, so pharmacy students, medical students, nursing students, being among the advocates. And so you had both directly, for example, there would be, I believe, advocacy days on the Hill, which is, say, Capitol Hill, before Congress, where we'd go to meet staffers to talk about whatever sort of HIV/AIDS issues, policies in terms of more funding, in terms of science-based, evidence-based policies, where you had both the seasoned health professionals who were there who could talk about their experiences, often in the field, in other countries, and the importance of what they're doing, of the funding, of science-based policies, again, of extra importance today. And then you had youth who brought just an idealism and enthusiasm, and a knowledge that really added to the meetings, and I think connected with the staff, who are also themselves often not too far out of school themselves, really connected. And so having that combination in meetings, but just more generally, where sometimes we would do a sign-on letter of health professionals who they're the deans, they're the professors of whatever, and they have the big titles and the really important experience and roles. And then you might have postcard campaigns and other things where you can really mobilize the numbers and the enthusiasm and the geographic spread that can come through organized health professional students to reach, lawmakers, because, in this district, there's this school, there's this really important lawmaker, and we have a chapter of 50 students at this medical school or this nursing school, and they all send postcards. That actually gets to be a pretty, large number for for a small place and can have an impact. They can meet, staff locally. And so really having both perspectives, both the experience, the energy, which doesn't say that seasoned professionals kind of energy too, or idealism, but having those and the numbers working together really, I think, was the case of more than the sum of its parts, and really important to our advocacy for on HIV/AIDS and the right to health more generally.
Amazing. Thank you so much for sharing those examples. And I think it was really interesting that you highlighted kind of examples from kind of different countries and where there's kind of different generations working on different issues, and how that is kind of intergenerational collaboration, as well as kind of more of a kind of a local kind of example as well. So yeah, I found that really interesting. Thank you. So then the next question is going to be to Mark, which is, what unique strengths do young leaders and experienced professionals each bring to the table in advancing health equity? And how can these strengths be effectively harnessed to complement each other when it comes to kind of decision-making processes?
Okay, so for the unique strengths that are both shared by experienced professionals and young leaders, first, I think there is a unique strength in knowledge transfer because older generations or seasoned professionals, they provide institutional knowledge and knowledge based on their experience themselves, as well as historical insights. So as compared to youth leaders, they have been here working on these advocacies, on these projects, on these campaigns much longer, and they have seen the changes and what can be improved as compared to youth leaders who are then starting to get involved themselves. So through this knowledge transfer, the youth themselves can offer innovative perspectives that can be adapted into and formalized through the help of seasoned professionals that can address modern challenges. So by combining these two perspectives on knowledge transfer and exchange of perspectives between seasoned professionals and young leaders, so I think this is one way that there can be sustainable changes that can be made, as well as these strengths are harnessed in decision making processes, especially in policy making and global health governance. So another strength that that are shared between the two generations is, of course, there is a need for both generations see the need for inclusive representation. So this can be done through collaboration and having diverse lived experiences that are participating in various conversations, in various initiatives, because these diverse experiences that come from different cultures, different perspectives, they can help shape the policies, making them more equitable and effective. So not only are they made equal, I would like to highlight this, not only are these policies made equal, but they are made equitable because they aim to address what are the root causes or the root challenges being experienced by various various localities or various people from different experiences and different cultures. So through this inclusive representation, both the young professionals and the experienced professionals can contribute to having policies that are more equitable and effective. So another important strength that I believe that is more on leaning with the younger young leaders is technology bridging, because as we all know, and I think we experience ourselves, that younger generations are often what we call as digital natives. So these digital era digitalization started start this digitalization is experienced by young leaders themselves, and um, this can help leverage technology on how technology can be used to improve, for example, collection of health data or communication and advocacy. So by bridging this technological strength from younger generation and taking into consideration the institutional knowledge of seasoned professionals, there can the gap between the two in terms of technology can be bridged. And lastly, which I think is important as well, is of course the sustainability of efforts. So um, in terms of sustainability of efforts, it's important that we empower the youth to ensure long-term and continuity in our health governance initiatives. So I'd like to expound on this more by citing my personal experience in working for the High Five for HIV project. So just a brief overview, High Five for HIV is one of the projects of IPSF in collaboration with UNAIDS and IFMSA, where we target to destigmatize HIV and AIDS in various countries. So just a fun thing to share as well, we named this project High Five because this is a way to destigmatize HIV, which is through human touch. So by giving people high five, we acknowledge their presence and we acknowledge the people living with HIV. So just a fun thing to share. Yeah. So through our collaboration with UNAIDS, we were able to connect to the pharmacy and we were able to connect the pharmacy and medical students from 3 countries, Kenya, Ghana, and South Africa, to their UNAIDS country offices and their respective professionals in those country offices. So, question, why did we connect our national healthcare student organizations to these UNAIDS country offices? This is because we need sustainability of efforts. So instead, by starting from scratch, the student organizations, through the help of the country offices, can identify what is currently being done to address and to destigmatize HIV and AIDS in their respective countries. So now, through the involvement of youth, different perspectives of improving HIV and AIDS campaigns come into place. So these campaigns and projects that are fruit or through built through the collaboration of the national student organizations and the professionals from the UNAIDS country offices, these are then reviewed by the global UNAIDS in collaboration with IFMSA and IPSF. So we can see in through different levels, there is intergenerational collaboration taking place. So our role now in collaboration with UNAIDS and IFMSA, we now determine the feasibility and impact of these initiatives. So in retrospect, we get to address and we get to evaluate these initiatives not only in a single perspective but through intergenerational collaboration. And I think this project can is one way of showing how sustainability of efforts can be shown concretely and through different initiatives. Thank you.
Thank you so much, Mark, for highlighting the importance of kind of technology bridging, sustainability, and giving us kind of such a positive example with kind of the High Five HIV project that's been done with you and UNAIDS. Amazing. So now we've come to kind of the end of the question section, and we're going to be opening up for any questions and answers that you have for either of our speakers. So feel free to type your questions in the chat, or you can kind of raise your hand and unmute yourself if you have any questions directly. So I'll just give you guys a few seconds to kind of finish thinking of your questions or typing them in the chat. Yes, Ileana, go ahead.
Hi, Beth. This is actually a question for you. I know that you're a moderator, but I am really interested in hearing about what the Youth Council is doing. Maybe you can use this time to talk a bit about some of the ongoing activities that can address some of these gaps and challenges that you all have discussed today.
Yeah, of course. Thank you so much for the question. So yeah, for people who aren't aware, the WHO has a youth council. It's currently in its 3rd year, so we've just kind of finished a term of 2 years, which kind of was how was the council was kind of setting itself up, kind of deciding how it was going to work exactly kind of within the WHO kind of space. And now we're on to kind of the second process, so another 2-year period in which we have some old organizations join us as well as some new ones. So altogether, there's about 25 youth organizations that are present as part of the WHO Youth Council. So something that we're really focusing on kind of in this kind of year and the next year is advising and having an advisory role instead of doing technical work when it comes to the WHO. So this is kind of on points in which the WHO wants advice from a youth perspective on a certain issue that they could potentially then come to us and kind of get our advice. Whereas we feel that the technical work, obviously we're only 25 youth organizations and there are thousands of youth organizations across the world that have maybe certain expertise in different issues. So there's also kind of the Civil Society Commission, which is a group of of non-governmental organizations that are kind of in collaboration and kind of working together on kind of WHO topics. And within this group, there's I think there are hundreds of youth organizations that are part of the Civil Society Commission. So as part of kind of the Youth Council, we see our role as kind of providing advice on certain issues. And then if there's kind of technical work that needs to be done or certain projects, to then kind of give these over to the different organizations that are part of the Civil Society Commission. So actually youth kind of working on the grassroots, working on the ground on different issues. So whether that might be HIV, as we've mentioned, or, health equity or issues such as malaria. So kind of getting their expertise in these topics. The other thing that we're trying to do is we have obviously the Global Youth Council. We're trying to have more regional youth councils. So for example, EMRO already have a youth council. And actually just yesterday, whilst at COP, one of our youth council members met with the regional directors of Sierra and Wipro, so the Asia Pacific regions, and handed over kind of a concept note explaining what a regional youth council would look like in those regions. And we're hoping to kind of hear back from them shortly about kind of how we can move forward in this to have kind of more regional representation of youth kind of within WHO structures. So I hope gives you some insight regarding that. And if you have any more questions, yeah, feel free to always kind of email me or ask them. There's a lot of work that's happening and we're trying to kind of get as many youth involved as possible because we're aware that we're just 25 people and by no means, whilst we are from different countries and backgrounds, we no way represent the entirety of youth. So we're trying to get as many kind of youth involved. So yeah, thank you so much for that question. And if anyone else has any questions, feel free to unmute or put them in the chat. If not, I have some as well, so we can always go for that. Okay, so in the means of time, I'm just going to go to my next question. And if anyone else has some again, please feel free to put them in the chat. So my next question is to both Mark and Eric, and it is, how can we ensure that intergenerational collaboration moves beyond symbolic inclusion of youth and leads to substantive influence in global health policy? So maybe Eric, if you want to start.
Sure, and if I just may, super quick, congratulations to Mark on the High Five initiative. That sounds super, and I just want to say the importance of what you're saying about digital and technical and how speaking as someone who grew up earlier in this technical age, you talk about seasoned professionals. Youth are the seasoned professionals when it comes to digital, and the potential is so huge in terms of accountability, in terms of actual medical applications. And so I think that's just really important thing to emphasize in terms of the tables are turned in terms of who is the expertise, because and even think about things where other folks who aren't as native to this as you said might not be even thinking about digital and all those sorts of things. Youth might be and have ideas that are just really excellent. So I just want to highlight that. And then in terms of the sort of moving beyond sort of just symbolic to actual representation, I would just say maybe a few really quick things. I think we're short on time. One, just a few of the points I made before in terms of being part of delegations and delegations that are specific to youth. It's great to learn more about the WHO's Youth Council. Another thing, just I think really carefully interrogating where you are or where you are in the spectrum of participation, which is say participation can be sort of consultation. You say something and then it goes into the black box and maybe not taken into effect. It could be you say something and then whoever's the one you're saying it to, the decision maker, has to respond in some way. They don't have to take your suggestion, but if they don't, they have to give some written response or something to sort of acknowledge you and the points. And I think that's really important step up to sort of consider where you are in that, and then the sort of third level of actually being among the decision makers, like in the Global Fund, one of the delegations that is part of the board. and maybe it's just a little bit different example, but something that Mark said made me think of it earlier. Is interning for particularly in lower income countries where there's a lot less capacity often for the people who are decision makers. So in government, um, who often don't have sort of the staff, the backup that say in the United States you might have, and so really would value this, particularly if the youth have the means, sort of free internship assistance, or if there could be NGO funding. There was some years back an initiative that funded, I believe there's, I think it was health ministers in 5 countries to have just sort of like an assistant. I don't think this was youth perspective, but it just really added to the capacity. It's the same way that legislators in the US and Congress certainly, have very large staffs, and that's just not true in lower income countries. And so being able to put yourself forward to people who might be involved in government, in the health space, in the global health space, could be a way for really that intergenerational collaboration, capacity building, really of benefit to both sides, the younger and the older. And so I just wanted to add that. Thank you.
Apologies, Eric. I know we have to wrap it up there. So thank you so much, Mark and Eric, for joining us. This was really insightful, as well as everyone who joined. Thank you so much. And yeah, enjoy the rest of your day.